Serena and Alice. We're really happy to be here. I am Alice Crisci, CEO and co-founder of MedAnswers that brings you the Fertility Answers app. And my dear friend, Serena H. Chen is a doctor in Northern New Jersey. She's a fertility specialist, an expert on our platform. And every week we like to bring you some small bites of conversation that hopefully will help propel you forward wherever you are with your fertility journey. Last time we talked about when things go awry. And 2/3 of the time, we know that IVF fails. And one of the things that I've been seeing lately, Serena, is really the emotional impact of that. And when I say emotional, I'm kind of coming to you and saying, is it really emotional or is it hormonal? I want to really help people understand the difference.
When Alice says 2/3 of the time it fails, she just talking about that one IVF cycle. Okay.
Yeah.
Right, Alice?
Yes.
Overall, if we find that if you stick with it, like we're more closer to like 90-95%.
Right. So the first time, yes, that the first cycle fails, and people go into it with the expectation that they will be the 1/3 that it's going to succeed on the first try.
Right. But just because you fail on the first try doesn't mean you're not going to succeed. In fact, a lot of people do.
Exactly. And that is Serena's message week after week is we're seeing 90 to 95% success if people don't drop out of treatment.
Yeah, because that's our big issue is like we're getting really sad because people drop out when they could have a baby. So we don't want that to happen to you. So is it your emotions? Is it hormones that?
How do you tell? I feel like
it's both. It's both. There's such a strong body-mind connection. It goes both ways. Okay. So we know that women are more prone to depression and anxiety. The prevalence of depression and anxiety in females is definitely higher than the male population. We don't know that that's necessarily due to hormones, but what's the difference between males and females other than our superior intellect? It is definitely our hormones are different.
Right.
So like maybe there is something to that. The other thing is we know that a very high risk time for depression in women is postpartum. So after delivery, massive drop in your hormones.
So quickly.
Your hormones during your menstrual cycle go like this. Pregnancy, it goes like this, like you can't even draw it to scale. So high with your hormones. And then the placenta comes out and boom, crash, bang.
Right.
It's a huge, massive drop. And the hormonal change is probably, I'd say, magnitudes different than puberty. And you know how that went, right? Puberty is a really tough emotional time. Really tough. And we do feel like a lot of the lability in puberty is not just due to growing up and being a young person and feeling insecure. It's also like a lot of these hormonal changes. So it's not to check out or to just say, well, it's not my fault, it's not under my control, because there are definitely things you can do to make things better. So we're not trying to give up control over this thing, but we are also saying you should be aware that you are going through some serious hormonal fluctuations, which are known to affect your emotions and even like things like your thinking and decision making and things like that.
Right.
So
seems like, and I see this all the time in which there's strains on relationships. And there's even kind of a strange sense of self, like, who am I? I don't recognize me. I want to get this over with because I want to return to me. And these things can all also, compound because you're going through something that's already challenging. It's physical, it's not non-invasive.
Oh my gosh, it's so physical.
So physical.
Yeah.
Right. And so
the other thing I worry about is that a lot of people stop exercising because there's a lot of data out there on the internet raising a possible concern about exercise and IVF. And I do not think there's enough data to take that number one stress reducer, exercise,
and getting rid
of the picture. We do not have enough data to throw exercise out. Now, having said
I was one of them.
You can't be doing CrossFit while your ovaries
exactly. Right. So not CrossFit, but gentle things. I will say though, because I went into my IVF cycle, I went into my frozen embryo transfer cycle, having already endured 4 pregnancy losses. I was terrified to do anything but walk.
Yeah, you feel like really so nervous.
Yes, and I didn't even do prenatal yoga until my 3rd trimester.
I know.
And then when I finally
you
had
know,
him, I
ultimately,
said, I want to be pregnant again so I can do it all again and not be so anxious, get a do-over, eat more of my omega-3s and do prenatal yoga and not be so afraid all the time.
Yeah, I know. And like you're always holding your breath. Like with recurrent loss, people hold their breath.
I mean,
sometimes
I was
for the
my breath
entire
talking about it. Yeah, my chest was like even revisiting those anxious feelings. So,
this is where I really wish more people would reach out and talk and connect and really seriously consider a mental health professional, a trained mental health professional. I know, I don't know why, I guess, is there a stigma? It's the cost, it's the barrier to care, it's like the lack of insurance coverage. But I just feel like that there's so much data showing that can be so helpful. And, when you're going through something this stressful, you need a village, you need some help, you need some support,
I think, and though it's not just support, kind of you're doing your shots, you might have your partner doing them for you. If you're a single mama, you might be doing it yourself and feeling really empowered. But the moment that you don't get that result that you want, you're trying to go into it hopeful and yet have realistic expectations.
Yeah,
and
that's a tough balance.
Oh, it's so hard. And you're thinking mind over matter. If I'm just positive, if I stay hopeful, I'm going to get the outcome that I want. You're doing all the visualization of the follicles, growing. I'm doing the visualization of the fetus growing. All these things are compounding into, and then when you go in there and you don't get the result you want, and then there's a hormonal crash.
Yeah.
So if you go into an egg retrieval, can you physiologically walk me through? My estrogen is high, correct? Your estrogen is pretty high when you're going for an egg retrieval.
Like 1,500 to 2,500 typically. And then, after retrieval, sometimes it drops down to normal levels, which is like a tenth of what it was in within the period of the egg retrieval, like 10 minutes. So that can really be a big crash. That can be really tough.
That's a big crash. And talk to me a little bit about, the impact of estrogen in general, because this is also estrogen as we age and we approach menopause is kind of the big one that as it declines, we have vaginal dryness, we have mood swings, we have all these things, but it's not the I feel so yummy hormone of progesterone that I love so much. Like, give me a little progesterone. I'm like, oh, I'm so soft and I lose my intensity. I feel really happy.
So estrogen is actually supposed to be a happy drug. It's supposed to be associated with good mood. And I do see a lot of people at the start of their cycle, especially if they're on Lupron or something, or pills or something like that, that when they stop the pills or they get their period on Lupron, their estrogen is at its lowest. A lot of people not get headaches and just feel kind of funny.
Right.
And an estrogen, once they start back on the estrogen, they do feel more normal in terms of their headaches and mood. Progesterone can be kind of sedating. So progesterone takes things down. Now for some people,
what works for me. I'm so high wired, right? I'm so wound up that I have a little progesterone. I'm like, ooh, I'm chill, Alice.
But that component in somebody who's already depressed can sometimes make things can sometimes make things worse. So we do have to be careful. And the other thing is there are many different kinds of progesterone. So when you talk about progesterone, there are some progesterones that are based on the actual 21 carbon progesterone molecule, which is kind of like what our body makes. But there's a lot of progesterones. All the progesterones that are in birth control pills, the vast majority of them are based upon testosterone, and they may not have any testosterone activity, but the actual starting molecule is 19 carbons, which is the testosterone skeleton, and that always seems very interesting to me, because here we are, the way we change this molecule from testosterone to a different to bind to the progesterone receptor, and it can actually decrease libido instead of increasing it. But those are very different types of progesterones. And then there's stuff like Provera and Megace, which are very commonly used to induce periods or to treat people with cancer. And those do things like increase your appetite. So there's a lot of interesting different things about these drugs. And
yeah,
and the other thing is
responding to them, you don't really know why.
Like, well, some of it is like the molecule itself, and some of it is like
right.
our bodies. All our bodies are different, and the same progesterone in me versus you could have very, very different side effects and very different effects at all different tissue levels. So it is important to understand that and to realize, and I think for doctors to realize that, your patient, you can't just dismiss what your patient is saying. If they're not comfortable, there are choices, and you should be able to get, you should be able to try something different. If this is not working for you, then, speak up, talk to your doctor. Don't just suffer in silence.
Got it. So a lot of women going through treatment, as their estrogen is rising, they might experience elevated mood. But then when the estrogen crashes, their mood might crash too.
It could be. It could be. Not everybody feels like that. Sure. I will say that the and all the husbands ask me, is my wife going to be a crazy loon? Am I going to have to like double lock the den door so she can't get at me? But most people, vast majority of people, the only side effect they feel is like, I'm a little tired. And is that because you're making all these extra eggs, or is it because like Dr. Chen is making you come to the office every day? We really don't know.
Right.
So that's the most common side effect. That's like, a lot of people get, they just like, it's just kind of tiring to go
through
IVF.
Tiring. I remember being exhausted.
Most people don't get crazy. Most people don't get nutty with the emotions. They know, and I think if you're prepared to know that it's a stressful process and you want to clear your calendar, clear your plate, this is not the time to do like extra volunteer activities during your IVF cycle.
Be gentle. Okay? Exactly.
Don't do extra projects. Don't take on new things.
Right.
Don't do like extra things that require a lot of decision making. You just make your life as simple as it possibly can, and just call in all your favors, and be good to yourself. Then you can hopefully reduce some of the stress. But I think if you're prepared to know, like, it's a lot of work, it can be stressful, and my hormones might be a little wacky, I think most people end up doing okay.
So after that, you've got that, couple weeks that you're stimulating the ovaries. And so estrogen is rising. Egg retrieval happens. Estrogen drops the same day or the day after? How quickly does it
drops? Like then, like we are pulling
as you take the eggs out, because you stopped doing, because you did the trigger shot. So you said no more estrogen production, and the trigger.
Well, but we're actually pulling the granulosa cells out.
Right.
So that's the source of estrogen and progesterone.
Got it.
So we are lowering estrogen, even though your progesterone will rise a little bit because you've ovulated. It's going to be, a lot of times it's not great progesterone levels either. So you're kind of low.
You're low. Now, does the body typically return to normal in like after one cycle? Do people typically have a quick period and like it's the body's natural way of kind of recalibrating it?
Yeah, then you're reset. You should be back to almost totally normal. Like if you had a ton of eggs, sometimes your ovaries still be a little bit big.
Sure.
And if your ovaries are a little bit big, your normal ovulation might be delayed anywhere from 0 to 7 days. But you're feeling pretty normal by the time you get your period, which should be, like 9-10 days later.
So it should be 9 or 10 days later. If it actually comes sooner than that, is that indicative of any problem or how you assimilate?
Not really. It's just like you had a bigger drop than that, so I don't think it's indicative of the issue, but because we're kind of creating a hormonal deficit.
You're manufacturing the system.
Just by, pulling the eggs out, because we have to pull the eggs out with the cells. They're surrounded by those cells. We can't help it.
Okay. Now, we touched on the idea of reproductive therapists in particular, because, this is a field that is really, I feel like, advanced for fertility, where we have reproductive specialists now that are attached to clinics or are in private practice, and we can find them online. We have a number of them actually in the Fertility Answers app that are available.
Did our psychologist, Dr. Pascal, is she doing
She's amazing. Yes.
Okay, great.
She actually answered one of my questions regarding Dante and his donor conception status.
Wow.
I was so grateful with the tender care that she answered the question, because even me, I've got questions too, and because I have a donor conceived son, I was asking some things around the psychology. This is something that he knows very, very much. We talk about it all the time. He's constantly referencing, well, I think I got that from my donor mama because I didn't get it from your DNA. He'll say things like, well, we don't know my total DNA because we didn't do this. Yeah. We didn't check 3 billion strands. We only looked at 23andMe, like 500,000, and she was so incredibly helpful in how to think about it and talk about it with him. So yes, that's awesome. She was fantastic. I highly recommend everybody hop on that.
Yeah, because you don't just have reproductive endocrinologists on the platform. You also have genetics people, psychology, so. Do you have maybe some embryology people too, right?
Yeah, we do. We have a great deal of
actually one of my embryologists.
We do, exactly. Yeah, we're really, and we love how they answer questions. Hey, look, no diss to my favorite doctors out there, but embryologists answer questions so educationally.
Yeah, they have a different approach.
They do, and even with a precision to how they answer, because it's about what they're doing. They have to be very precise with their hands and how they approach their profession. So some of the embryologists who are answering questions on our app, I just love how they do it.
Awesome.
Yeah. So, the one takeaway that we keep coming back to every single week is don't be afraid to speak up. Your voice is vital. And when you're experiencing, you're like, I don't feel like myself, raise your hand and say, Doc, do you have a reproductive endocrinologist? Or apologies, do you have a reproductive psychologist for me, that's attached to your practice? And even if there's not one that's attached to the practice, a lot of the
there's ways to find that.
Yeah.
People can reach out on the app and not only talk directly to a reproductive psychologist, but also get a referral in their specific area.
They can.
So, that's definitely something that we can help with.
We can. Yeah. Just click that request consult button or email navigators at medanswers.com and we will find somebody for you. So Monday Motivation, as always, we love being here with you all. Type questions, put in the comments. We are available to you on the app, off the app, and Monday Motivation with Alice and Serena will be back next week. About the same time, barring any technology issues, and we're just so grateful for being.
We're a little soft with our time, so be patient.
Yeah,
thank you.
Exactly. All right, take care, everyone.